this is Piccline placement with ECG-Guidance. What you need to do the procedure is local anesthetic, the puncture needle, the guide wire. After accessing with the guide wire, you have to do a little incision. Then you take the split off over the guide wire, and afterwards place the Piccline into the split off sheet. Then we're going to do an ECG control and see that the position of the catheter is okay. And what else you need is a probe cover, fixation device, stud lock, and that's it. Positioning the patient and the ultrasound machine is important. So the patient's left arm I use mostly, since the most patients are right-handed. So I use always the opposite side of what the patient is, right-handed or left-handed. The ultrasound machine is placed on the other side. That's it. So here is the arm of the patient, and the ultrasound is on the other side. First thing is I check that the left side of the screen is left side of the probe. And here I can see some round structures. So what I'm going to do, I'm going to compress and find out what is arteria and what is the vein. And then I just place my probe over the vein and follow the vein and see if it's going straight or if it's taking some kind of curvy way. Okay, now I have the vein in a longitudinal axis. Now first thing is I'm going to place some local anesthetic. So here is a little poke coming right now. I'm placing a little bit of local anesthetic just beneath the skin. Then I go, stick comes a little poke. Perfect. So then I take the guide wire into the vessel. Supposed to go freely. So then just take out. Okay, thank you. Stop. Okay, next thing is that I check with the ultrasound that the guide wire is actually in the vein. Okay, here comes a little poke again. So since we're using the split up technique, we have to go in. It's supposed to be gliding freely. Oh. It's going freely in and out. Can we take the catheter a little bit closer now? And next step is let me actually pull out everything. With the guide wire stuff. Now I'm telling the patient to put the chin on the left side of the shoulder in order to hopefully guide the catheter in the right direction. Please do that now. And now I'm going to push the catheter further in, and it's supposed to slide in easily without any resistance. So what I'm doing now is that, and it's going in nicely, I'm happy with that. I take a little bit this out and divide it up. Take it out a little bit, divide, take out, divide, and compress. Okay, so now the patient, the catheter is maximal in the patient, and I have adapted the EKG cable here. So this means that the tip of the catheter is going to be switched over to from the right EKG lead to intracardial EKG lead. Since this is a Crochon catheter with a valve in the tip, we need a little bit of fluid going all the time in order to be able to see something. So now you can see extracardial EKG. What I'm doing now is down here, I'm going to switch over to intracardial EKG by switching over the switch box like this. Great. And so we're going to push a little bit of fluid here, and we will see if we can see some kind of EKG right now. Okay, so we can see actually now a P, which is quite high. What I'm going to do is I'm going to take out the catheter a couple of centimeters and see the change. Right here I'm at 50 centimeters, 48, and my aim is to have a maximal P visible. Okay. Now we can see that we have a high P, and I'm going to pull the catheter out until I think we have a max value. It's getting higher even still. Even higher. And now I think it's getting smaller again. So I'm going to push it back in 1 centimeter more. So this is going to be the optimum position for the catheter. And it is at 42, let me see here. Read on the catheter. Now it's actually at 48 centimeters skin level. I'm going to disconnect this clamp here, disconnect this one, and take out the guide wire which is in the catheter. Now I will cut the catheter so that it's maybe a couple of centimeters longer than what we can see here. So the actual catheter is going to be cut right here. Okay. Next step is that I will connect this end piece, which comes in a separately. And this is this little metal. Okay, now I need my swimming glasses. Here it is very important to be careful with the catheter, otherwise you can make holes in it if you... And then this one goes like a... You have to hear the sound that it's connected. Okay. Checking the catheter. Blood return. Injecting. Okay, now comes the fixation with the stat lock device. So I want to fixate the catheter somewhat like this. It's not supposed to kink, and that's so the fixation is going to be up here. I'm using the skin prep pad. Wait 15 seconds. and then use the stat lock which comes with the catheter. You can see I loosen the wings a little bit, and now I find the optimal position, for example like this. Okay, perfect. Say it is an RB 3000, and I always take the middle of the insertion point as my target bonded placement. Okay, stop. Last step is to fixate the catheter. So we're using the surgical, or what you call it, pull it over like this so that you have like maybe 10 centimeters here. And then we just pull it over the whole catheter. Place a little hole here. Pull the catheter through this little hole. Okay. And then we just pull this one over everything. So I'm placing a bit of a tape right here so that it's maybe a little bit like this here. Okay. Meaning is that if you want to use the catheter, you just pull up, connect, use it, and if you're not using it, you can pull this over the arm so the patient can easily wear clothes and without that the catheter is getting disconnected.